If you want to know 4 tips to get CrossFitters out of pain and back in the gym faster, you need to tune into this episode. Uh, Hi, everyone. Welcome back to the podcast. Welcome all new listeners and welcome back to those who have heard my content in the past. If you want to know 4 tips to get CrossFitters out of pain and back in the gym faster, you need to tune into this episode. Before I go on to the podcast, what is new in life? There's always stuff happening, especially in my life, probably yours as well. But family, we are going on a vacation, and I am so excited to just get some time away from the family and just spend time just talking about life and kind of what's next for our family. So we have vacation planned. I just signed up for my first ever. For those of you who've been following me for a while or new to my world, might know that I'm into CrossFit, functional fitness, intensity. I'm in love with intensity and heavy load. I signed up for my first CrossFit competition. I know. Everyone's shaking their heads as they listen to this. I'll tell you how it goes, but word on the street, it has bar muscle ups, if you know that I've been working on those things. So I'm really excited about that. It is a partner workout, and I'll share more and more down the line. Just prepping for my barbell athlete webinar. If you haven't registered for that, do that today. Join me. That's for free. That's on the 11th of October, 2022 at 5 p.m. Pacific Standard Time. And that's just to hang out and talk about barbell athletes over some wine or some beer or whatever you're going to have. Hang out with me on an evening. And then just getting ready for the management of the barbell athlete course, which is happening October 15th and 16th of 2022. But other than that, life is amazing. All right, let's go on to this podcast. So what are 4 tips? Like, why am I talking about this? All right. I work with a lot of barbell athletes. I've worked with them for over the last decade, both elite community members, beginners, you name it. I've worked with CrossFit coaches. I've worked with functional fitness coaches, just basically anybody who touches a barbell with intensity, so speed, load, whatever that is. I've learned a lot of things about working with these individuals, and they always ask, Chris, where do I find physical therapists like yourself or have the same mentality, or how do I find people who are a little bit more progressive? And I want to share what they would appreciate and the things that I've heard working with these individuals, their coaches, and to expedite giving them the best possible outcome, because that's all they want. That's all you want to be able to do as well. You don't want to be the no PT. If you've read my last newsletter or my last podcast, you don't want to be the no PT. You want to be the when PT. What I mean by that is that you don't want to tell them no. You just want to say when. It's like talking to my kids, or if anybody out there has young ones, you start to learn as a parent that if you say no too often, it's very, very difficult for them to. They won't ask you questions. They won't trust you. So it becomes like, well, when. So the same thing with patients and athletes. They want to know when. When can they get back? What can they do? When can they do it? So let's go through this. All right. I just went over this with my team recently, and when you're mapping out somebody's return to the gym, their box, their whatever it is that they call like their haven for exercise, there's 3 things you can offer: green lights, yellow lights, or red lights. So green lights would be like, oh, if you have back pain, you're okay to pick up the barbell from the ground. You're okay to do deadlifting. You're okay to back squat. That's a green light. And then there's yellow lights. Well, you can't go over 50% of when your 1 rep max. You can't do front squat. You can't do full depth. Those are yellow lights would be you can squat, but you can only do partial depth. You can deadlift, but you can only do below 50%. So those are all yellow lights. And then there's red lights, which is no, you cannot deadlift at all. No, you cannot do pull-ups. No, you cannot do bench press with the barbell above 90 degrees or whatever that is. So those are all red lights. And the question always comes about, well, which one should I focus on as a physical therapist, providing information to these athletes? Like, what's the best way? Because there's 3 different strategies there. And when you're a clinician I think when you start as maybe a new grad, or you start working with an athlete you're not familiar with, you give them green lights because you want to make them hopeful. You want to give them like a route, like, hey, yeah, don't worry about it. You'll be able to do that. Go ahead. Yeah, those are good. Yeah, those are great. Those are a lot of green lights. Well, if you give too many green lights, uh, and you don't give enough yellows or reds, what'll happen is they start calling you more, they start texting you more, they start emailing you more. Why? Because you've never solved the ultimate questions of like what they can't do. So they'll always continue like, well, can I do a wall ball? Can I do a pistol squat? Can I do ring muscle ups? Can I do a push press? Can I do They'll start asking you all these questions, and you're like, oh my goodness, what is going on? And I've learned that as an established clinician working with these individuals, my biggest recommendation to you is to provide them red lights early on. Now, you're not being the no PT, you're becoming a red light PT with an emphasis on when. So, for instance, if somebody says, hey, my back is hurting, can I deadlift? Well, that's a very general question. Well, you can, but you can't pick up the bar from the ground. So you might have to put it onto a rack and then load it from there. So you're basically only picking it up from the top, and you can go partial range to mid shin and then right back up. So you can do that with lighter than 40% of your 1 rep max 3 times a week at 5 reps maximum. Wow, that's a lot of information. So the answer to no deadlifting is, man, that's an absolute red. That's tough. So you want to give as many red lights as you possibly can. You cannot pick up more than 50 pounds or 150 pounds or 40% of your 1 rep max for the next 2 weeks. That's a hard red. Okay, great. Like now, at least they have that guideline. They won't call you anymore. You can deadlift, you can back squat 3 times a week, but no more than 50% of your 1 rep max. Okay, now we're going somewhere. So you want to establish those red lights early, and then think about when. So that's one thing I've learned really quickly is that CrossFitters, they love having a roadmap. They want to know like, well, when can I do it? Like, well, the rest of the class is doing it. And you have to realize to know these individuals, you have to know that they are intense. They love the community aspect. And so by you not allowing them to go back in the gym, you're like saying you can't hang out with your friends. And that's the truth. And so when you're thinking about like, well, they never listen to me, they don't do their homework, blah, 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 blah. No. It's the PT's fault. Okay. The physical therapist needs to know how to manage these individuals. So not every kid is the same. Not every patient is the same. Not every athlete is the same. So you just have to learn how to manage them. How do you work with them? Is a good way to say that. So they want to get back to the community. So just allowing them the red lights allows them to still know that they can go back in the gym, but these are the hard no's you can't do. Give them the yellows, and then allow them a little bit of wiggle room. Now, with that, uh, you now are going to be faced with, okay, well, the next session, you know what they're going to ask you is, okay, what's next? Like, what's the next one? I know it's 2 weeks for the red, but what about some more yellows? But if you create the hard red lights right there and then early on, they will trust you. They now won't email you or text you or call you in between sessions, which is a big deal to these individuals. They just want to know what they can do for the next week or two while they continue to see you. So that's step number one. Number two, is you have to, it kind of goes along with this, you have to create the outline for full return to unrestricted CrossFit. So for instance, if they're having shoulder pain and they say, well, you know what, it hurts every time I do, overhead pressing. Okay, great. So no barbell work. So now I'm going to say, okay, you can't strict press, push jerk, split jerk. Okay, is that with a barbell or dumbbell? With a barbell. Okay, great. So on a dumbbell, how much can I go? No more than 50 pounds, or no more than, what everybody else is doing, modified one level down. So like 10 pounds down. Okay, so if they're doing 50-pound dumbbell, you can only do 40. Got it. All right, so no strict press. Okay, with a barbell. Great. So your red light is no strict press with the barbell overhead. Great. What are my yellow lights? You can do dumbbell. Great. And then for how long? You have 2 weeks. Let's go through the acute inflammatory phase and get you into subacute. Let's get you out of that 2 week zone And then now we can progress from 2 to 6. We'll progress getting back underneath the barbell. But first, for the first 2 weeks, you are under a dumbbell. Fair. How many days a week? 3 days max. Now they have an outline. And when do you expect full return? 6 weeks. Great. So from 2 to 6 is now the next route. So we're going to start with light barbell, strict press, just working through that. Great. Now we're going to add add a little bit of load, but then now as you progress, push, press, push, jerk, and clean and jerks, then you're going to start to progressively add load there, or start with a barbell and progressively add load as you go on. So you can see now this sequence of events, and that's all the patient athlete wants. The CrossFitter doesn't need to know like exacts; they just need to know guidelines. So okay, at week 3, you can go back to the barbell with strict press. Got it. When can I do clean and jerks? Well, that's not going to be to the very end. So that's going to be around week 5. Got it. So when can I go unrestricted? Week 6. I see. And the concern I see with a lot of physical therapists is like, and you're going to shake your head at this. You're guilty of this too. What if they don't get to 100% by week 6? And I told them that. No, 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 no. I didn't say pain-free. I said return to sport or return to the gym at week 6 with modifications, potentially unrestricted. Now, physical therapists, it's hard for them. It's hard. I mentor a lot of you. It's hard for you to commit to a number because you're scared of being wrong. The athlete doesn't care. They just want a guideline. That's all they care about. You are the perfectionist, OCD, sports PT, but they don't care. That's your problem that you can't commit. And who cares if you commit? Just say a number and give a range, 4 to 6. Just don't do like weeks 8 to 100. You got to give them a guideline. So give them a general outline, stick to it, and move on. Stop overthinking it, okay? Because that's all they want. So rule number 1, give them the red lights, okay? Right away, immediately. Number 2, create the outline and give them a number and stick to it. Who cares? They don't care. I promise you. I work with a lot of these athletes, and they wish they had somebody who was just a little bit more like fluid and like not so perfectionist and just go. Like, I don't care. Just give me a route. Most people take too long to give them answers. Number 3, work with their coaches, with their CrossFit coaches to create modifications. Now, some physical therapists hesitate, or I don't know what it is, but they have a hard time. Maybe it's time or resource, whatever it is. They have a hard time reaching out to these coaches. The funny thing is that these coaches, like, they want to work with physical therapists. Like, they like the idea, but the problem is that these physical therapists, they're high and mighty, and they try and use their profession or their career, whatever it is, as a very difficult barrier to have communication with these individuals. For some reason, I think that sometimes it's a battle between who knows what and whose territory. Who cares? Most of the time, CrossFit coaches know way more than physical therapists when it comes to CrossFit type of things like programming and exercise modification and movements and progressions, because it's specific to the sport. Now, they might not know every single movement quality and everything else, but they know CrossFit. They coach it every day. So use that as leverage to help this patient or athlete get to the next level. And I don't know what it is, but sometimes physical therapists have a hard time like acknowledging that or whatever it is. But either way, one of the best things you can do and be like, I don't know CrossFit. I only know a little bit. I've done a couple classes. Can you help me? Wow. Think about that as a physical therapist. Like, you actually have to acknowledge that you don't know something. And that's okay. That's okay. Believe me, I still do it. I'm like, hey, coach, can you help me with this? Because I'm still struggling because I can't see myself. Like, I don't know what I'm doing wrong here. So just know where your limits are and ask for help and ask them the coaches. So what'll happen is, if you try and say, hey, to the patient athlete, I'm going to modify every single movement, like, you can't, because they don't announce their workouts. A lot of gyms will say, hey, we don't announce workouts until the morning of. You don't want that athlete texting you or calling you every single morning and saying, hey, here's the workout. What do you want me to modify? That's a whole different level. No, no, no. What you want to do is just have a general modifications and work with the coaches and say, hey, they're having back pain. Here are the red lights, here are the yellow lights, and here are the green lights for the next week. Can you work with them on that? Perfect. That would take you 3 minutes on the phone. And if the coach says, like, listen, if they got back pain, they can't pull from the ground, they can't do overhead press, perfect. I got it. What can they do? Dumbbells, kettlebells? Perfect. I'll do that. And then can they go into a little bit of aches and pains, but not pain? Yes, perfect. And once you establish that relationship, guess what? You now have another arm. You have more leverage to help more people. And that's essentially what we want to do in this planet, just help more patients and athletes. So work with the coaches to create modifications. And if you know how to do it, great. Work with the modifications, send them home with some homework, allow the strength coach to have a little bit of line of communication with you, and then you will increase your reach and leverage your ability to help more people. I promise you. Okay, that's number three. Number four is a very debatable one for a lot of clinicians, but I will tell you, these people love it, they need it, and they want it. Allow CrossFit athletes to use external devices to get through phases of healing and beyond. Okay, so what I mean by this is anytime I get in a conversation with maybe a physical therapist who's a little bit more rigid in their processes or their views on certain things, whether that's modalities or bracing or taping or, oh my goodness, ultrasound or whatever it is, like whatever it is. I'm a true believer that there's always a place. I worked in pro sports, so there's definitely times where you do need like certain modalities that you need to be able to use at certain timelines. So taping, absolutely, you're going to be taping early on, and maybe later down the line you wean from it. McKenzie treatment, like ultrasound, whatever it is. So bracing is definitely something that is used heavily when it comes to either pro athletes or barbell athletes, and so what I mean by this is like sometimes you're going to need like knee sleeves or knee braces. Sometimes you're going to use like wrist wraps. Sometimes you're going to use elbow sleeves. Sometimes you're going to use lifters, or sometimes you're going to use all these different types of braces, and that's very, very normal, especially in the CrossFit world. This is something that is very, very common, and I want you to know that if you can help them find the external device to help them get through a phase of healing, they will love you for it. So say, for instance, I personally use knee sleeves on a regular basis. I use lifting shoes on a regular basis. I'd say those are my main ones. Yeah. So all right. So those are the main two. But there are some people who need like wrist wraps. There are some people who need elbow sleeves. And that's very, very standard. So, but just know that as a physical therapist, your job is not to impose your beliefs on them. Your job is to get them to the point where they can exercise, be pain-free, and get back to the gym. For some people, if they have wrist injuries, sometimes those wrist sleeves or those wrist wraps are good for them just to get through that phase of healing. Now, you have to know that, okay, well, how long are they going to use them for? Well, what about an elbow sleeve? Why would I use that? Well, maybe they're having pain with snatching or overhead pressing, and maybe it's the end range or pull-ups, and it's the end range elbow extension or hyperextension that gets them, and maybe they need the brace to block them from getting to that point just so they can get through a phase of healing. What you have to use it as is an adjunct to get them to the next level. So, for instance, taping. I'll usually tape and brace early on for the first 2 weeks minimum to get them out of that subacute phase, and then wean them back into heavier loading as I wean away from the brace, keep them on tape, get them back to load, remove the tape. If they still have some stuff or irritation, then I'll put them back in a brace. You just have to know when to push and pull with these things and when's a permanent use of these things. So if you ask me like, well, why do you use knee sleeves? I like the warmth on my knee. Honestly, I just love it. I think that I like the compression. It just gives me like sensory input. I like the external stability, like a weight belt. Somebody has back pain and they're getting back to CrossFit or whatever it is, and they're just picking up 30, 40%. Is a weight belt okay? I mean, just to get the sensory component of it, but you ultimately have to get them to have the confidence and the strength to be able to do that independently. So do I rely on the weight belt? No. Do I get them using early phases? Sure. Why not? The first 6 weeks, great. And then as they go on, you wean them from the actual weight belt at week 6, let them go up to 80, 90%, then you bring them back on. I use weight belts around 85% and up in general. That's like 2 or 3 reps. So I'll still have them use a weight belt regardless of injury or not. So you can use that weight belt to get you through that phase, wean them from it, and only use it for normal purposes, 85% and up. So ultimately, you're trying to set this person up for success. And if you don't, number one, give them the red lights. They're going to be calling you, asking you for every single exercise. Is it okay? Number two, you have to create that outline for them to understand what week by week progression, what's it going to look like for me to get there. Number three, contact their coaches, have an extra arm, modify things, allow you to learn from somebody else who does this day in, day out, and then give the patient or athlete options to be able to, take advantage of external devices to get them through phases of healing, because all this person wants is to get back into that community, get back with the people they know, laugh and have fun, and then work out and have high intensity workouts at the same time. So don't ever think that they're stubborn. Don't ever think that they don't listen to you. It's probably that you're not speaking their language, you're not providing the outline for them, you're not working under the conditions that they need. And this is going to be the same for, you can insert CrossFitter with like an F45 or Orange Theory or anywhere where it's a community-based activity, and there's a central coach at the start of the class who's kind of overseeing everything, and then there's unique terminology with certain movements that are specific to that community. So it's the same guidelines, and it's what I would recommend to my team, recommend to the physical therapist that I mentor. Just continue to provide those 4 tips, and it'll set you up for success. Don't make it complicated. Don't give them like the craziest exercise that's on Instagram or YouTube. Don't like impose your old school way of thinking. Just because somebody else does it, don't do it. I'm telling you, be open to servicing these individuals with their unique needs in their specific community. And so once you do that, you're going to set yourself up, because these people are going to be referring people back to you. And that's all you want to do. You want to have that, like, you want to know that you are the person, you're the guy, the girl, the person that can help athletes in your community. That's what you're all trying to do. And you shake your head right now, I can totally see you. And if you want to be that person, that's what's going to do it for you. And I'm telling you, because I've done it. We've done it in San Diego. We like love our community. And the more you can do that, the more you become the specialist that people want to go see, and they want their family, their friends, and everybody else to see. And you become known as that sports specialist or the barbell specialist or whatever it is. So if that helps, I'm excited to hear you put it into place. And if you want to learn more, I'd start with 2 different places. Attend my webinar on October 11th, 2022, from 5 to 7 Pacific Standard Time. Or number 2 is, if you really want to go in depth and you're like, you want to know more CrossFit, you want to know powerlifting, you want to know anything barbell athletes, weightlifters, Olympic weightlifting, maybe you want to learn some more of that. Maybe you're frustrated that you haven't been able to reach out to CrossFit coaches or weightlifting coaches, and you want to take that next step. You would then take my Management of the Barbell Athlete course, and that's October 15th and 16th, 2022 in San Diego, or hybrid. I've done them both. I've been doing them for years now. If you want to go online, we'll have somebody dedicated just to watching your mechanics, helping you with that. If you're going to be live in person, you're going to be working with me. So in either case, we'll have a big pair of eyes on you. So whatever that means for you, I'm excited to see you there. I will see you while I'll be on vacation. I will see you in the next couple of weeks, either on my webinar or at the course. If not, I will see you on the next episode. All right, take care, everyone.